I was on top of the SUV handing some of the luggage down and lost my balance. I just went head first and hit my head on the ground, and at that time I broke my neck. After my initial cervical injury, my discs started to compress in my spinal column. You can imagine the pain that accompanied that. I also started to lean forward with a type of scoliosis, not being able to walk straight up and be able to address individuals and make eye-to-eye contact. I had at one point given up in living. I couldn't see myself continuing on. When Dr. Lim told me that he would take my case, I was completely ecstatic. It gave me hope.
Mr. Booz's surgery was very, very complicated. Incision in his back, screws into his spine. We use a saw and drill and basically break his back. An incision on the side of his stomach. Took out several bones, put in a titanium strut, took out discs in the front, connected rods to the screws that we had placed previously in his back, and added bone to get everything to heal.
The conclusion and the outcome of that was for me to get out of bed and stand up straight.
The Department of Orthopedic Surgery at Advocate Christ Medical Center provides comprehensive and expert orthopedic and podiatry care.
We do both the basic type procedures. We take care of the tertiary and quaternary cases in the area, so we see a lot of the complicated cases.
We have specialties in every conceivable area.
Most of our group members are fellowship trained in certain subspecialty areas.
What's unique about our department is that we consist of 6 separate private practice groups.
To know that I can consult someone else in another group is great for the patient as a whole and the institution as a whole.
The Bone and Joint Institute was developed about 8 years ago.
Since the hospital formed the institute, we have had double-digit growth in orthopedic surgery every year. Our patient satisfaction is up, our outcomes are better, our results are better.
We provide state-of-the-art care using the latest procedures and technology.
We actually had the first integrated navigation suite for total joint replacements in the city.
There's a lot of science involved, and the more technology we have, the easier it is to perform our job safely and accurately, and we have the highest quality implants that are available now.
About 5 years ago, I first noticed that I was having problems with my knee.
He was holding on constantly to railings and to chairs.
I tripped and fell twice, so yeah, I knew it was time.
A joint reconstruction people think of as basically human carpentry, but there's more to it than that. There's an artistic side where you have to take someone who has deformity and pain and swelling and improve their quality of life.
Within 3 weeks of the surgery, I had a marked improvement. I was back to work.
He has made great strides. Unfortunately, now he has a Costco card.
When we first went to Costco, I would sit in the car because I didn't want to do the walking. And now I'm hell on wheels.
We have 6 orthopedic residents that rotate here on a regular basis.
The residents truly love coming to Christ. It's one of the busiest rotations they have. They rank this program in this hospital as one of the top hospitals in their rotations.
They get a very diverse training here, especially in the area of trauma where patients are being transferred from the entire region.
In addition, Christ has started a podiatry residency program that is a huge win for our institution.
I knew the community here could use a podiatry residency. Those residents provide another set of eyes and ears and hands.
Residents keep you on your toes. They know all the current techniques.
They help us be better doctors. They challenge us.
A patient's care is not just directed by the surgeon, but involves an entire team.
The surgeries that Dr. Luke and I do would be nothing without our nursing staff.
It's nurses caring, it's the phlebotomists caring, the anesthesiologists to make sure that their pain is controlled. It's people who try and make sure your patients do well.
Nikki, a nurse, I didn't have to ask for anything. She anticipated everything I'd want.
Physical therapy is really well developed here and a great staff.
I attribute that recovery to the therapists and the doctors in the rehabilitation unit.
When I started here, it was Christ Community Hospital. And with the growth of the department and the surgeons that came on staff, we've gotten to the point where people want to come here and want to be transferred here.
Patients do not have to go downtown to the major medical centers. We are a major medical center.
When you come to Christ Medical Center for your musculoskeletal care, you're in good hands.
And I'm glad I had it done. My quality of life has increased markedly since I had the surgery done.
I'm able to smile again. I'm able to laugh again, thanks to these great doctors.